Erbs palsy is a condition that is characterized by loss of motion and weakness in the arm. While it can happen in both adults and infants, this condition often occurs during birth when difficult delivery stretches a baby's neck to the side. This traumatic force causes damage to the network of nerves located near the neck called the brachial plexus. It's estimated that Erbs palsy occurs in approximately 2.6 out of every 1,000 births. Some of the more common symptoms of Erbs palsy include lack of movement in the shoulder or arm, diminished or absent reflexes in one arm, awkward positioning of the arm, poor grip strength, and diminished feeling or sensation in the arm or shoulders. Parents need to monitor their children and quickly arrange for a medical diagnosis and treatment if their child shows any of these signs. A nerve injury can ultimately affect the development and growth of the child's shoulder. Several causes can contribute to Erbs palsy. Poorly managed maternal diabetes or gestational diabetes, which can lead to larger babies and more complex deliveries. A breech birth when babies are born feet first. Improper birthing techniques and tools that cause the baby to be pulled out too quickly and forcibly from the birth canal. Large babies with petite mothers can make the delivery process more difficult. Extended labor can put the infant at a greater risk, such as the second stage of the labor process lasting for a significant period, especially over an hour. Most often, it's a doctor or a pediatrician who diagnoses Erbs palsy after a physical examination, usually based on the weakness of the child's arms. While the severity of this condition tends to decrease with time, 10% of children diagnosed with Erbs palsy will continue to suffer from its symptoms. There are treatments available for Erbs palsy depending on the severity of the condition. In some cases, non-surgical recovery, which includes daily physical therapy, may be an effective treatment. A physical therapist can provide exercises and routines to follow and repeat at home to enhance the child's recovery and increase their range of motion. These exercises promote the child's healing and prevent joint stiffness in the shoulders, wrists, hands, and elbows. If physical therapy doesn't improve results in 3 to 6 months, the doctor may recommend surgery to repair the damaged nerves. Depending on the severity of the nerve injury, repairing a ruptured nerve by splicing a donor nerve from another child may be an option known as a nerve graft. Another option is to perform a nerve transfer using a nerve from another muscle as a donor. Recovery following these surgeries can take months or even years to fully repair and heal these nerves. After surgery, a doctor or physical therapist should provide rehabilitation exercises to improve your child's strength and range of motion. There are other medical procedures doctors can use to treat this condition, such as surgically releasing thickened soft tissues around the shoulder and elbow joints to allow more motion, or by transferring a functioning tendon from another area in the body to the child's shoulder area to improve their ability to raise their arm. Even after medical treatments like these, some children may still experience weakness in their arms and require further surgeries as they get older. Unfortunately, if your child suffers from Erbs palsy, you can be looking at a multitude of treatment-related bills and expenses. Many of the initial surgeries for Erbs palsy can cost families thousands of dollars. Even after the surgeries are complete, follow-up with physical and occupational therapies will be necessary and may require prescription medications to help with pain and recovery. Parents of a child with Erbs palsy will often have to miss work to take care of their child, which can result in a loss of wages. As living with Erbs palsy is not easy, many families seek therapy to help them handle the diagnosis and the effects of the condition. There are many national organizations that provide further support for parents or caregivers to someone with Erbs palsy. Both the United Brachial Plexus Network and Mothers United for Moral Support provide families with the emotional aid and hope they need to get through such a devastating time. These groups offer real-world information that help parents find additional resources regarding treatment plans and other available options. If you believe your child's Erbs palsy was caused by another person's wrongful, negligent, or reckless actions, you should seek legal help. Contact a lawyer to review your case, as you may be entitled to compensation to cover the cost of therapy and your child's long-term care. You can learn more about causes, treatments, family forums, parent support groups, and more at birthinjurycenter.org. The Birth Injury Center is here to assist you, offering consultations and abundant resources. For your own peace of mind, please visit birthinjurycenter.org.